So without further ado, I'm going to introduce our speaker today, David Shelton, Chief Operating Officer for PatientMatters. He has been the Operations Vice President at MASH, which is our Medical Advocacy Services for Healthcare Incorporated, for 8 years prior to joining PatientMatters through the company's acquisition. He has extensive national and international experience in medical manufacturing and distribution. His career also includes a role as a general manager for a large national service company, which included insurance industry experience. David holds a bachelor's degree of business administration from Texas Wesleyan University in Fort Worth. So David, are you ready to take it away?
Absolutely. Thanks very much, Betsy.
So
Good afternoon, and thanks for joining today. You know, the Affordable Care Act has created a lot of challenges and opportunities for hospitals. Whether you're in an expansion state or not, one of the areas that we've seen impacted is how Medicaid and the different government programs have been altered or changed. That's caused different challenges for the hospitals to be able to handle patients, the patient volume, and the new rules and regulations that come through with that. So we wanted to go through today, kind of give an overview of how advocates at work during the Affordable Care Act in your states and what you can expect to see coming up in the near future. At PatientMatters, we define an advocate as a highly trained person who directly interacts with and represents hospitals' self-pay patients, looking for every opportunity for a payment solution. That can include county programs, state programs, disability, and even the hospital charity programs. So we think an advocate should be an expert in all of those government agency opportunities. Advocates screen every patient, inpatient, outpatient, ED, and it's a key here within 24 hours. It doesn't do any good to screen someone several days after they've been to the hospital. We think 24 hours is an important part of that. Using federal, state, county, and hospital charity programs, the advocates work with the patients to find the best government payer source available. And if there is no government or hospital charity program, PatientMatters advocates even have the ability in some of our hospitals to be able to help patients put together and get involved in different loan opportunities and put them into a financial position that works best for the patient, not something that is burdensome that causes the patient to be unsuccessful in completing their obligation. A lot of hospitals come back and they say, hey, that sounds great, but that sounds like the job of our financial counselors or our social workers. So why do I need an advocate? How come I can't take care of the government applications from our hospital financial counselors? And we hear that often, and the answer is simple. Your patients need more time and assistance than your staff can reasonably be expected to give. There's just too much work there, and truthfully, too much volume of patients coming in that we're seeing with the changes with the Affordable Care Act in the exchange states, that there's too much work to be able to keep up with. So let's do this. If we could, let's kind of get, so I can get a feel of who's on the call today. If you'll just take a moment, and if your hospital is using advocates, third-party advocates, to be able to help with your self-pay patients, if you'll click A on your keyboard, or if you're doing it internally, if you'll click B on your keyboard, we'll wait just a second and let that tabulate, and that'll kind of give me a feel for the audience and how we want to go through the presentation. So if you'll click one of those keys, we'll wait just a second for that to come through. And there it goes. All right, so it looks like about 60% of you are using internal hospital staff to take care of your self-pay patients. So that means I've got a little persuading to do as we go through the remainder of the presentation. You know, advocates, one of the key things that we feel for an advocate, the advocate actually represents the patient and is recognized by a government agency as the individual that can speak on behalf of the patient. One of the things that we've seen with hospitals, you know, when we're representing patients, we sign government programs, 1696 documents, different things that we say we're speaking on behalf of the patient. We see a lot of hospitals don't want to have their employees in that same situation because it could be a little bit of a conflict. If the patients come through the hospital and I'm working to be able to get them on different programs and the hospital is taking care of both those sides of representation, we see hospitals shying away from that. An advocate focuses solely on the patient and their personal overall situation. What that could include is even making sure that the patient makes it to the appropriate government meetings on time. A lot of times they have to go and be interviewed at different agencies. Is your staff prepared to do that? Doing home visits. We even, to the extent to have our advocates that will help secure transportation, go pick the patient up if we need to, or even help patients arrange for child services and things like that whenever they have to go do something during the day. Finally, an advocate also has to know all the government and hospital programs that are available to the patient in your area. So there's a lot of different things that an advocate has to do. In addition to that, advocates also, in a Patient Matters world, work disability claims. You probably have experienced this with claims that you have, but when you're going through the disability claim, that process can end up taking, in some counties, as long as 24 months to be able to finish from the start through the initial filing, through reconsideration, and then if you have to go before an administrative law judge. And you probably have seen it, but did you know that more than 70% of all disability claims are denied at initial filing? And there's a simple reason for that. Government agencies train their staff to screen people out. At Patient Matters, we experience greater than a 50% success rate on the initial filing whenever we're representing patients with a disability claim. We train our staff to be able to get people into the program. Another option that we also do as well is our advocates work with patients to help them find different payer sources whenever there's not a government program available or a hospital charity program. Patient Matters works with hospitals using no-interest loans, other different patient-friendly solutions that allow the patient to not only get a reasonable monthly payment, in many cases a no-interest loan payment, but to get a reasonable monthly payment that the patient can make and be successful with, so that the hospital can have their financial obligations met as well. In other words, the Patient Matters advocate has a relationship with the patient that is different than the hospital relationship with the patient, and that's simply because of this. Patients know that the hospital has an expectation that the hospital needs to get paid for the services that they've done. And in many cases, we find that patients are not fully upfront with the hospital because they have the information they don't want to share. When an advocate comes in from a third-party group like Patient Matters, that advocate feels a comfort level and a relationship is built that is different than the hospital level and allows the patient to be more forthright, and then also allows not the advocate to be able to find a bunch of information out saying report back to the hospital, but to find a solution for the patient so that the patient can be properly taken care of. You know, I pulled this out and just as a look of the 2014 expansion, you know, there's 20 states, including D.C., that are expansion states. Of course, Utah, Indiana, Missouri, they're all looking at different options. And regardless of the recent election and the more Republicans that have come into office, states are having challenges, and I'm sure hospitals, your hospitals are experiencing the challenges of how are you going to get patients to be able to pay. Expanded Medicaid is a solution. You know, people are watching the state of Arkansas and some of the hybrid changes that they've done. So there's a lot of talk that's still going on, regardless of your political persuasion or how the government has changed over the last election. You know, one of the challenges that we see with hospitals, there's increasing self-pay volumes, especially if you're in an expansion state. You know, so many more people in expansion states now qualify for Medicaid than before. Even now that resources have been taken out of the equation, more people qualify for it. Is your current staff able to handle the volume of people that are coming in? Another thing that we see is hospitals don't have the tracking system to be able to monitor the status of the self-pay patients through the government processes. And I've included just a copy of a report that Patient Matters uses, but we have over 300 custom reports that are designed to track the casework that's being done, the success rate by the advocate, case activity, because you want to make sure that that case isn't sitting idle. If you have a case that's going through disability that could take up to 24 months, you should have an expectation that your advocate is every 30 days at least in touch with that patient, making sure their personal situation hasn't changed, and that that case is still a viable case as it's moving to the ALJ process. Monitoring your case inventory, your success rates by your staff. That my experience and what we've seen out in the field is there just isn't reporting information available in the hospital information system that allows you as a hospital to manage your internal employees and to ensure that your cases are being worked timely, correctly, and as quickly as possible so that you can manage that inventory as it's coming through. Another thing that we see that's coming through is hospital churn. And this is one of the challenges I know that hospitals that has existed before expansion, but it is even more prevalent now. And churn is simply defined as a change of coverage that occurs with lower income patients. And you guys have seen it before. A patient starts as Medicaid when he comes in the hospital. He gets a job and he loses their Medicaid because now they're over income, or maybe at this time of year he's picked up seasonal employment for the holidays with an additional part-time job. So the patient gets that job. He goes on the company insurance at a later date, either because the patient now no longer has the part-time job, or perhaps he's lost his job. He can't afford COBRA, so he's going to have to go back onto the Medicaid now. Does your staff have the ability, have the time to track that patient as they go through their cycle of life through their job positions? Our experience is not. And does your HIS, can it track the patient, follow up with the patient, schedule future non-medical events with the patient? Can they do all the different things that are necessary to make sure that that patient gets back into that Medicaid program so that the hospital continue to get reimbursed? And our experience is no, there's just more work there than hospital staff is able to accommodate. So how does Patient Matters advocates, how do we keep up? Because we're going to do some things. We put advocates on site at the facilities that we work with. Those advocates use a proprietary software system that allows each of them to manage their caseload, to schedule events, to track the case as it's coming through the process. All of their case notes, everything that goes through there is downloaded into the hospital system every night. So as a hospital, you know where we are, as well as the work that's being done. We also utilize a patient engagement center. And our patient engagement center is a great support piece for our field advocates. Our ED business comes through our patient engagement center. It's a multilingual workforce. And I've just listed a few of the languages that we have there: Spanish, Vietnamese, German, French, Russian, Navajo. We have other skills and abilities with some of our employees in the field. Our engagement center can connect those employees into the telephone call so that we can speak with your patients in a language they're comfortable with, quickly determine what the best course of action is for each one of them, and make sure that we move that through in a timely manner so that your AAR days are not extended. Also, all of our PEC employees are certified application counselors. Everyone is a CAC. We keep that certification current, and it allows us to be able to help, especially this time of year, whenever we're going through the opportunity for people to sign back up for the Affordable Care Act. Our group does over 88,000 outbound calls per month. We have more than 7,600 inbound calls, more than 20,000 pieces of outbound mail, because we communicate with your patients in several different ways. We utilize texting as one example. We found that we can get patients that are in that 18 to 35, 40-year-old age bracket. If we send them a text message, that's not a HIPAA problem for us. If we send them a message that says, "I just left you a message, would you please call me back?" We get great response from patients contacting us back again. We also have the ability to be able to email, use e-signatures for applications, all of that to be able to keep that patient engaged. And I think what the great thing about it is that when that patient engagement center connects with that patient, screens them, determines that they're going to qualify for any number of programs that would be available in your area, screens them to the correct program, we actually live transfer that patient back to the field office, back to your hospital, to the employees on site. And we do that for several reasons. It helps the patient stay better engaged. We find that patients don't want to be communicating with a call center, but they do appreciate getting fast, courteous service to determine what is the best avenue for them to pursue. And that advocate at your hospital, when a patient says that they're maybe staying at a shelter or something like that, the advocate at your hospital is familiar with those shelters. They understand, and the patient feels like they've got a connection with someone, whereas someone in our engagement center might not know what the facility is the patient's living. So there's a lot of things that allow us to keep engaged with the patient and keep the patient staying active through the entire application process. Now, How can hospitals work together with advocates? The secret is it's a partnership. Whenever I always give this example, we had an employee in New Mexico that has worked at one of our hospitals for several years, and the employee was recently awarded the Hospital Employee of the Month award because the hospital actually thought it was one of their employees. Whenever you have your employees so ingrained into the hospital system, when we're doing that, working that as a partnership together, we find that patients are much more cooperative, easy to work with, and allow us to be able to get your financial counselors and your other staff the information they need to be able to properly do their job. Our advocates work together with your DHS workers. We visit with your local Medicaid offices to find out exactly how those offices or your DHS worker would like to have their applications submitted. Everybody knows every office has a different way they want to have it done. When we can give them a full, completed package, it allows the application to be processed more quickly, better utilizes the DHS worker's time, and allows you to get paid back more quickly. And like we discussed, an advocate should never be handing out an application. We always expect our advocates to work with your patients to complete the application, to work with them to coordinate the different meetings and events that they'll need to attend, to collect the various pieces of information that are required to be able to complete an application. But if your team is just handing out an application and then calling back to see if it's being completed, it's just not going to happen. And so we just believe that relationship between the advocate and patient is paramount to being successful. Also, our partnership events that we do with hospitals include health fairs. We've worked with various hospitals putting health fairs together for this time of year when people are signing back up again to get re-enrolled for their insurance for next year. We also do lunch and learn events, and I included a picture. The picture on the left is actually a hospital in North Carolina where we partnered with a hospital in Blue Cross to come out and get people signed up for the Affordable Care Act and get them put into the insurance opportunities. The picture on the right is actually in Arkansas where we worked with a hospital. We actually coordinated with news events. The hospital CFO actually got a lot of airtime, and what the hospital experienced was this: a community that was appreciative of the effort that was put forward, a community then that came back to the hospital with insurance, so the hospital now had an opportunity to get paid, and what the hospital experienced was a self-pay patient that now had an insurance card and an increased census because of it. So we just think there's a lot of opportunities and ways that you can partner together to be most successful to work a patient, to let the patient still, a self-pay patient still feel that they have dignity, that they're being treated the same as everybody else, and that there are solutions available for them to be able to work through the situation that they're experiencing in your hospital. So finally, the advocate advantages are simply a staff that's available to handle all your self-pay patients. You've got to have the right number of people there to be able to work through that. Extensive government program expertise. It's more than just completing an application. You've got to know the programs. You've got to be familiar with the hospital charity programs. You've got to know what's going on in that community in order to be a successful advocate. A reporting and tracking system that allows the patient referrals to be worked all the way through and reported back to the hospital, so the hospital always knows the status of every patient, which ultimately produce an improved patient satisfaction. Patient satisfaction scores become more and more important to you as a hospital as we're moving ahead. What we find is the self-pay patients, we can work with them so that their opinion and their thoughts of the hospital always come back with an improved patient satisfaction score for you as a hospital.